Welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here with Peter, and today we're going to do something a little different. Normally, we talk about things that are, I'm going to say, more timeless, that apply all the time. But there's some pretty hot news that's out there that I think's worth discussing.
Absolutely. Doctor, one of the things I've seen is a lot of questions and concern about the prior approval process.
It's true, and I mean, I did do a podcast on this just a couple weeks ago, as a matter of fact. But yesterday, an article came out talking about healthcare fraud and the DOJ taking down one of the largest healthcare busts in the history of the United States at 14.6 billion with the B dollars in fraud, and it involved doctors and nurses and pharmacies, generally targeting Medicare and Medicaid, but also some commercial plans.
And it's scary as we've talked about before. I've got a friend who's going through this whole process on surgeries on the back and the extra time that's being put on because of the prior approval process.
Mm-hmm.
Actually probably has worked in her benefit to heal faster.
Right. And so this is where we get into this push-pull, right? So there's obviously a lot of push to minimize or eliminate prior authorizations. There's a lot of push to eliminate or minimize any disruption in care for the member. And we agree with that. We want the member experience to be as smooth as possible. But we have to also live in the real world. And, I hate to say it, but there are bad actors in the medical profession, both as physicians and as facilities and as pharmacies. And so if you rip all the controls out, the people that have the propensity to commit fraud, basically what you're doing is just opening the door and saying, go ahead, do it.
In the pharmaceutical industry, I don't know of that many companies that do a pre-approval process on the pharmaceutical unless the prices are getting pretty high.
Well, and so now we're getting into a whole different realm. And there's lots of lawsuits going on with that, multi-billion-dollar lawsuits, because the major carriers own the pharmacy and own the doctors, and they're prescribing within their circle, and therefore there's no incentive to save any money, and therefore they're not acting as a good fiduciary for their plan members, specifically the self-insured plans, where there's a different level of responsibility, and the plan itself is supposed to be assisting, facilitating the employer group in how to save money. But the way they've structured their deals, there's all kinds of internal kickbacks, and they call it flip authorizations, where they're flipping authorizations in and out of network so they can get higher reimbursements, charging the employer more money. So there's all kinds of things going on like that, which would probably fall into this fraud ring as well, but it's being approached through different kinds of lawsuits.
The system is so broken. There's no doubt that there's every place.
It really is. I mean, I was in the security forces in the Air Force, as many of us may have mentioned before, and we used to say locked doors are to keep honest people honest. And you think that's a bizarre thing to say, but if you prop your door open, even somebody that's honest might walk in and do something bad because you've allowed that to happen. You haven't put up a physical barrier that they can visually see to remind them, oh, I'm supposed to be good. And that's a bizarre thing to say, but that's the reality that we live in, right? And that's the same in a system that's as complex as the medical system. I hate to say it, physicians and facilities have been programmed on this revenue cycle, right? I have to see somebody, I have to do X, Y, and Z, and if I do X, Y, and Z, my coding goes from a routine care to the next level of care, and then I did a medication and blah, blah, blah. So now instead of making $75, I'm making $200 when I really just needed to do the $75 deal.
Right.
But I'm on this revenue cycle. And so I'm constantly working to make sure that I'm doing the maximum amount that I can reasonably do for a member. Now, is that bad medicine? Debatable. Maybe not. All right. But is it really ethical as well if that's the driving factor? Even if it's not in the forefront of your brain, if it's in the back of your brain, I'm going to see Peter and I'm going to spend 15 minutes with you, and I want to wring every dollar out of that visit that I can, because I know when I file that claim with the major carrier, I'm going to be in some kind of fight with them, possibly a denial, blah, 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 right?
Right.
So if I'm not billing $200 and collecting $100, I'm losing money. If I'm billing 75 and collecting 25, I've definitely lost money, right?
Right.
So ideally, what we'd want to do is get in relationships with people that pay me fair and fast, generally maybe in cash, maybe direct, or I don't have to play the EOB game with,
Right.
the explanation of benefits game, claims game.
Well, we have the patient advocates to help people walk through this process.
Right. And we're kind of unique in that. So, but even with our patient advocates, and we do prior authorizations, and I'm a fan, but I want them to be done quickly, and I want them to be done as smoothly as possible, because we know in our scenario we have some facilities that have the propensity to recommend procedures that may or may not be necessary. In some cases, they are not. Doctors that are prescribing medications based on what the member asks for instead of what they actually need, or without going through other alternatives. I mean, I'm all about new medicine. I think advances in medication, are some of the reasons why people have a higher quality of life for a longer period nowadays than they did, 50 years ago.
Right.
Right? I mean, life expectancy was going up. Now it's starting to go back down. But that's a whole nother discussion, and we'll talk about that later. All right.
But technology and research costs.
Yeah, but in technology research costs. However, is it good medicine? And so we've talked about this before. We're one of the few countries that allows the pharmaceutical industry to advertise, right?
Right.
And so what we've done is condition people to watching TV or listening to the radio or whatever, and they hear blah, 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 and this is the silver bullet that's going to cure this disease, and and suddenly I won't have a little rash or whatever. And then at the very end they go, here's all the things that, you could suffer heart failure, liver damage, and da-da-da-da-da-da-da-da, and they say it really fast.
I know.
And a different pitch.
They're funny to watch because it's clear up your skin or die.
Right. Right. And it's like, maybe I could live with a little rash, that's not, and not have my liver and organs, annihilated by this drug. I don't know. Just me, so, we think for thousands of years we've treated ourselves through natural medications and herbs and oils and things like that. And ironically, we're able to solve most of our problems, right? I'm not talking about big diseases, but most of the things that we have, like, GERD and things like that. Why do I have heartburn? Because I eat junk food, right? Change my diet, change my gut health, put some cabbage in there, a little bit of sauerkraut, change my biome in my stomach, and suddenly I don't have indigestion every day.
Yeah.
So, but I hate to say, our medical community is so conditioned to issuing a pill instead of giving dietary advice. We've created a whole specialist of nutritionists.
Absolutely.
Didn't exist decades ago. You went and saw your primary care doctor, he'd smack you around a little bit and say, eat your vegetables. All right. Stop drinking every day. All right. I'm not saying you can't have a glass of wine, but don't have a bottle of wine. Right? I'm not saying you can't have a beer, but if you're up to a 12-pack, you're going wrong.
I knew I missed something in
You know,
there.
so but I mean that's what our primary care doctors used to do.
Yeah.
So driving that back to this fraud thing, right? If you read Sue, and there's articles all over the place. You know, I actually pulled one from Jim Hoff, who just did another distillation of it, but they're all the same. They're talking about transnational criminal organizations. Transnational, that means people from overseas are stealing from us, all right, through these collaborations, all right? And this is, you know, international sourcing of medications. This is telemedicine. You know,
Yep.
we've had telemedicine. We've had members call and say, "My telemedicine doctor told me to get this invasive surgery." No, your telemedicine doctor should have referred you to a specialist who actually physically look at you and do a real diagnostic to see if that's necessary. We don't want anybody to put a scope in them or do any kind of invasive anything, you know, without having a significant medical need for that. It's dangerous.
It is.
All medical procedures, regardless of how routine they seem to be, colonoscopies being a big one, if you're putting a foreign object in your body, you're taking a risk. And you need to be very cognitively aware of what that risk is, right?
Exactly.
You know, it's the same as, you know, you don't go downrange when you're shooting bullets because you might get hit. All right? All right? There's a reason doctors carry medical malpractice. There's a reason, you know, that you hear the stories about, you know, people going in for surgery and they removed the wrong thing. Should have never happened, but it does. All right?
Yep.
So
So we're kind of throwing the baby out with the bathwater.
you really are. And so sometimes when you're trying to solve a problem, because it can be a problem, it can certainly be burdensome the way the system's set up, you know, especially with some of the larger plans where I hate to say denial's like the first thing.
Yeah.
All right. Trying to solve that problem, and remember, the government's only going to solve it for Medicare and Medicaid. They're not trying to say, yeah, you say it sounds like they're going to solve it for everybody, but they're not. The government does not regulate the
Right.
major insurers. They regulate Medicare and Medicaid, all right?
Right.
Not your employer-driven health plan, all right? So when we talk about these things and you're like, you know, $27 million here, $703 million scheme for Medicare, where they were using Medicare identifiers for fake people in filing claims. You know,
Yes.
I think maybe if you did a pre-auth, you might have caught that. You know, like this person's not real. Maybe we shouldn't pay this claim. All right. And we have one of the defendants, like, is in Pakistan, in the Arab Emirates, and they had a billing company, and they used individuals for addictive treatment. Right, $650 million for substance abuse treatment. $650 million. All right, to do that. And so you've got these opioid prescriptions and all these other things, mostly through telemedicine in this case, you know, but they're like, people just don't know. And so fraudulent wound care is a big one. They've got all these really kind of cool and sexy wound care things, very expensive, most of the time not needed unless you're a diabetic and you have problems with your wounds healing and things like that. $1.1 billion in fraud for wound care. All right, in this DOJ complaint. All right, again, targeting the vulnerable, the elderly patients. They just don't know better. They're used to saying, "Oh, that's what my doctor said," so they're not even asking the question of why do I need this.
No, they don't.
And if you're on Medicaid, you don't have any skin in the game. You're not paying anything.
Exactly.
So, but all of us that pay taxes are. All right. And if you take all of that mentality and you translate it over to an employer group, how many employer groups are paying for medications, unnecessary procedures, and things like that? Because I hate to say, the doctor that one of their members went to see is not necessarily a good actor.
Yep.
You know, we had this happen just last year. We had a member called. They needed a surgery. We knew who the doctor was that recommended it. Unfortunately, that doctor is known in our community as a cutter, somebody that does surgeries, right?
Yeah,
Remember,
finds a reason to do
the
surgeries.
person didn't need surgery. We got a second opinion. They looked at it. They went, no, there's a different way to solve this that doesn't involve, opening this member up. It's significantly, better cost wise and better risk and health wise. And the member's doing great today as a result of that. So this is the kind of things that we have to be aware of.
Right.
That, one of the reasons we have authorizations, they were talking about 74 defendants, including 44 licensed medical professionals charged across 58 cases in connection with illegal diversion of $15 million in prescription pills.
Wow.
All right. One of those was a Texas pharmacy charged with unlawful distribution of 3 million of those pills. All right. Conspired to distribute massive quantities of oxycodone, hydrocodone, and things like that, which we know are highly addictive. All right. Unfortunately have a high resale value out on the non-medical black market. These are the kind of things that we have to watch for. And by having a good plan partner like Ovation that's watching your medical spend for your members, for the pharmacy, making sure that people are getting things that are medically necessary and are not getting things that are not. That, somebody really has their eye on the ball, you actually can preclude these kinds of things. Because even on a small scale, if you're a small company, just a little bit of fraud can significantly impact your bottom line and cost you significantly more money. So when you're going into your next plan year, and we talk about our plans not going up every year, which is a big deal for us, right?
Right.
And you're going, well, why is my plan going up 10% or 15%? Well, we ought to be able to show you the data to say this is why, and that you should know in part of the process how you got there, right? Should never be a surprise, right? We just did a quote last week for a group. It's gone up 50% under their Buca plan, 50% in the last 2 years. Zero claims data to support it. And when I look at that and I think, how much of that is, I'd say greed? They can
Right.
just raise rates because
what
they
can I
can raise
do?
rates, right? And how much of that could have been prevented? How much of that was fraud that may have increased their medical spend unnecessarily, which also drove a rate increase?
Absolutely. Doctor, you bring up another issue that anybody who is taking care of their parents or they're older, when they go to the doctor, to bring somebody with them that can hear and listen to what the doctor is saying, as is very easy not to be attentive when the doctor's telling you what your issue might be, what the medications might be. It's just a much better protection. We have the patient advocates to help do that, but if you have a parent you're taking to the doctor, or you're over 45, it's a much better practice to bring somebody with you.
It's okay to be skeptical, and it's okay to ask why. Why are you sending me for this test? What is it going to do?
Yep.
If this test comes back positive, what's next?
What's the benefit for me?
Yeah,
what's it gonna
what
do
if I
for
don't
me?
take this test? Is that going to really change anything? Or, are you doing this because, to protect yourself, right? You just want to make sure everything's tested. Are you doing this because you think I actually need it? All right. So those are a lot of questions that people should ask. I mean, like I say all the time, we should engage in healthcare consumption the way we engage in every other kind of consumerism. It should be well informed. You should ask a lot of questions, and you should treat the money that you're spending as your money. Because even if your employer is paying a significant portion of your premium, you don't get confused. That means you're getting paid less.
Right.
You're collecting less in your check because your employer is diverting those funds to your health care.
Part of the package.
Part of the package, right? Oh, you want me to buy healthcare? Great. So now instead of making $30 an hour, you're making $25 an hour.
Right.
You know, so those are the things we have to pay attention to. Anyway, that's it for the Pulse of Healthcare. We'll come back with another one pretty soon. Peter, thank you so much.
Thank you, Dr. John. Always entertaining as well as educational. Thanks.
Excellent. Have a good one.